What are intrusive thoughts? Intrusive thoughts are a common phenomenon experienced by many people, and yet they are often misunderstood and stigmatized. Intrusive thoughts are defined as unwanted, recurrent, and disturbing thoughts or images that enter a person's mind without their consent. These thoughts can be distressing, anxiety-provoking, and can cause significant impairment in a person's daily life. Intrusive thoughts can be experienced by people of all ages, genders, and backgrounds, and they are not indicative of a person's character or morality. There are several types of intrusive thoughts, but they can generally be grouped into 4 categories: aggressive, sexual, religious, and contamination. Aggressive intrusive thoughts involve violent or harmful images, such as thoughts of harming oneself or others. Sexual intrusive thoughts involve sexual fantasies or images that are unwanted and disturbing. Religious intrusive thoughts involve blasphemous or sacrilegious thoughts that go against a person's religious beliefs. Contamination intrusive thoughts involve obsessive thoughts about germs, dirt, or contamination. It is important to note that having intrusive thoughts does not mean that a person wants to act on these thoughts. In fact, people with intrusive thoughts often experience significant distress and shame over the content of their thoughts, and they may go to great lengths to avoid situations or people that trigger these thoughts. It is estimated that up to 90% of people experience intrusive thoughts at some point in their lives, but for some people, these thoughts become so distressing and disruptive that they interfere with daily functioning. One of the most common misconceptions about intrusive thoughts is that they are a sign of mental illness or that they are indicative of a person's true desires or intentions. However, this is not the case. Intrusive thoughts are a normal and common part of the human experience, and they are not indicative of a person's character or morality. In fact, research has shown that people who experience intrusive thoughts are often more empathetic and sensitive than those who do not. While intrusive thoughts can be distressing, there are several strategies that can be used to manage them. One of the most effective strategies is cognitive behavioral therapy, CBT, which involves identifying and challenging the negative thoughts and beliefs that are associated with intrusive thoughts. CBT can help people develop more realistic and positive ways of thinking, which can reduce the frequency and intensity of intrusive thoughts. Another effective strategy for managing intrusive thoughts is mindfulness meditation. Mindfulness involves bringing one's attention to the present moment, without judgment or criticism. By practicing mindfulness, people can learn to observe their thoughts without getting caught up in them or reacting to them. This can help reduce the distress associated with intrusive thoughts and can promote greater emotional regulation and well-being. In some cases, medication may be recommended to manage intrusive thoughts, particularly if they are associated with other mental health conditions such as anxiety or depression. However, medication should only be used under the guidance of a qualified healthcare professional, and it is not always necessary for managing intrusive thoughts. It is also important to remember that seeking help for intrusive thoughts is a sign of strength, not weakness. Many people struggle with intrusive thoughts, and it is important to reach out for support when needed. There are several resources available, including mental health professionals, support groups, and online resources. In conclusion, intrusive thoughts are a common and normal part of the human experience, and they are not indicative of a person's character or morality. While they can be distressing and disruptive, there are several strategies that can be used to manage them, including cognitive behavioral therapy, mindfulness meditation, and medication. It is important to seek help if intrusive thoughts are interfering with daily functioning, and to remember that seeking help is a sign of strength. With the right support and resources, it is possible to manage intrusive thoughts and lead a fulfilling life.